It's Tuesday, like 5:33. I had one idea of a video to make, and then I watched two of Kale's videos. One was a response to Carson, and one was the video that Carson responded to, and through that I found Carson again, which was a relief, I guess, because I feel like there's so few of us represented that don't perfectly fit into this the box, the I want to transition so I can be 100% male box. And that's absolutely no offense to anybody who wants that. I totally 100% support that as something that you want to do and the reason that you're transitioning. But it has been really hard lately for me, just looking and dealing with that. Part of it's because my therapist has been, though I do adore my therapist, I think she's an excellent therapist as well as an excellent human being. We agree on a lot, both spiritually and about sort of the binary and things like that. But it's made this process very difficult, all because of this liability, and the liability is, and all of this standards of care has been completely and utterly degrading to go through. Because we have to basically fit me in some little box that I don't really fit well into. And I know I've talked about this a lot, and so I don't really want to talk about it too much more right now. It's just been incredibly difficult. And it's also made me more dysphoric in the world. I can't decide yet if I'm one of those people that really cares or not if I pass, because there are times where I really care and I'm really offended and bothered, and then there are times when I really don't. The ones that have become the most offensive are the phone, because besides my chest, the other thing that I am the most dysphoric about is my voice, and I never get the sirs, I get the ma'am. And yes, I live in the South, so it's what people do here. The things that are really upsetting is, going in a nice store, like really nice store, and clearly shopping in the men's section and being called ladies. I don't understand this. That started, I guess, around the 3rd or 4th year we were together, and it will be 8 years this year. I do not understand this need to gender things. I've been sort of slowly eking into using the men's bathroom, mostly to see if I can do it. It's not really to see if I can. I've actually never really ran into anybody, with the exception of one time at Walmart with a friend, and she ran into somebody, which was very funny because the women's bathroom was actually blocked off for I guess maintenance, and he then proceeded to go into the women's bathroom to complain to the, yes, I'll say it, Walmart employee, late night Walmart trip, there's nothing else to do, to complain that there was a woman in the men's bathroom. Because he was in a stall, and I'm guessing he noticed she put her purse down, or one of the 19 other things she did. I don't know. He didn't see me at all. I came and I went, and I didn't put anything on the floor. I did pee, but I don't really care. Men pee in the stall all the time. 5 minutes of completely useless dribble. I'm sorry I look like shit, though. I have been sick, like, additional non-Lyme sick for about a week now. My back has been killing me. The MRI came back. It's normal. It's perfectly normal. So normal that a med student should study it. Except that my nerves are damaged, and you can't see that on an MRI. So, injections for me. I called my OBGYN today, which was a lovely experience. Because I think I did confuse the woman on the phone a bit, but I have literally been in, like, dysphoria hell. Bleeding for a week is bad enough, but for 5 weeks nonstop is not only physically painful because of the endometriosis and the cysts, but incredibly just, because I've had a chronic illness for so long, I think I've gotten very, very good at just completely shutting off my brain from my body. I can just totally not be present when things happen, and this has made it really difficult to continue to sort of keep that separation. It looks like I'm going to go on injections of a drug that maybe had they given me it when I was like 14, I probably wouldn't have needed. It's Bella, by the way. It's her foot. I wouldn't have needed to transition at all, because basically it cuts down all the estrogen, which should help with the endometriosis pain that I'm experiencing. I'm probably going to talk to her and see if I can maybe go on some low-dose testosterone, not injections, maybe cream. I don't want to go on T long-term, but I am really interested in finding out if this is something that would be possible and a good thing to do right now. Because I can only go on these injections, the ones that cut off the estrogen, for so long. It's just it's a temporary fix until we can permanently go through and have the surgery, which sucks because I would be having it this summer, except I'm having top surgery this summer. At this point, I would almost say that the histo is more important, but the top surgery is already scheduled. Bella butt. Thank you, dog. Mustache. But the top surgery is already scheduled, so that's gonna have to go first. And Bella is infiltrating the bed. I'm sorry. Oh, yes, even I get distracted. So, that will probably have to wait until November to do the histo. A full histo, ovaries, and everything are going. I can't risk it. I don't have a huge family history of ovarian cancer, but I just, or uterine cancer, but there's like a medical precedent that makes it absolutely necessary.